detachment of placenta from the uterus before the delivery, sir. So it is very uncommon, but yet it can be a serious complication and can be threatening both to mother and baby. So basically there is causes unknown, but there are certain risk factors which initiate this process of placental abruption, and the most important are there are certain placental pathological conditions like chorioamnionitis and their infections, STDs, PIDs, history, age factor, unhealthy lifestyle of mother like taking alcohol and smoking and drugs, etc., previous history of any miscarriages. These things, they mostly contribute. Late dystosis. So these are certain conditions which basically involved in this process. And sir, if you talk about its symptoms, basic symptoms are painful uterine contractions and bleeding. Bleeding can be heavy and mild, and sometimes no bleeding depending upon the situation of the placental abruption. And basically placental abruption can be categorized into two categories before mature enough. So what we have to do, that we have to carefully monitor and hospitalize the patient, carefully monitoring vaginal examination, blood testing, etc., and proper bed rest and hospitalization. And then after 2 or 3 weeks, if the conditions are normal, we can go towards the vaginal delivery if there are no certain other complications. But if some complications, then we could go into the C-section. And if the baby is at term, so we can notice the situation. If normally okay, we can do, and if there is anything that will jeopardize the health of both mother and baby, then we will go to the C-section. And so there are certain complications for this, for both for mother and for the fetus also. For mother especially, if heavy blood loss, mother can go to the shock, can go to the liver and kidney damage especially. So it can cause. And for male, for baby, you know that fetus is getting supply of oxygen and nutrients from the placenta, and if it will deviate, it can go towards hypoxia, fetal hypoxia, and if it will go towards the stillbirth and premature birth of the baby. So these are the certain things that we have to do.